Well, tonight we're here to talk about the silent progression of fibrosis in the body. It's one of those conditions that I think one point or another everybody's going to experience. But before we get started, I want to talk about some stuff with the practice. So let's move forward. So you can basically find us everywhere. We're on TikTok, Facebook, YouTube, Instagram, Rumble, and our website too as well. This is a great avenue to teach everyone out there what we do. We give a lot of our information out. We do testimonials with patients. We do some education. We also do some protocols of what nutrition we use for different conditions. Thanks to Lauren and Trish, they've done a great job with getting us everywhere. So feel free to follow us on all those spots. We also do virtual appointments. We have several patients that are around the country, some of them even outside the country, that we'll do a doxy format, kind of like a Zoom. And we'll sit down with patients. We'll go over their blood work. We'll go over a hair mineral analysis. We'll talk to them about their history, what's going on in their lives, and then we'll put protocols together. We had great success with this. We have a lot of patients that will refer us, their relatives and friends, and we help out a lot of people from more places than just Michigan. We can ship whatever we need, whatever protocol we come up with you, we can ship it to you wherever you're at. I think it's usually 2 or 3 days out, if I'm not mistaken. And if you put in the order by 3 o'clock, I think that's about the time frame it'll get to you. It'll come to your doorstep and you'll be ready to start that protocol, whatever that protocol will be. So let's get started. Let's talk about this condition called fibrosis that I think you'll have a better understanding about once I describe it and talk about it tonight. Fibrosis is used to describe tissue that is overgrown, hardened, and or scarred because of chronic inflammatory process. I want to begin by looking at how fibrosis can impact the musculoskeletal system first. It can hit all tissues in the body, but I want to talk about how it hits the musculoskeletal tissue and how it's going to have an impact on us, leading to neurological dysfunction with possible disease-causing implications. Specifically, I want to address something many people have had or felt over time and didn't understand completely. Fibrosis involving ligaments, tendons, and muscular tissue will cause the person to become stiff, rigid with their movements. With fibrosis, we're not talking about calcification like we would get in osteoarthritis. Osteoarthritis sometimes will calcify the joints. That's not what we're talking about here. We're talking about the surrounding tissue, the ligaments, the tendons, the muscles becoming hardened because of injury and what happens with the injury and the cascading effect of what happens at a cellular level. So it's nothing like osteoarthritis. It's completely different. But the stiffening of the soft tissue through changes in cellular activity is what happens there. These changes cause the tissue to become less elastic, therefore preventing flexible movements. We lose our range of motion. We observe this in patients with repetitive injuries, chronic overuse, sports injuries, affecting tendons and muscles from a musculoskeletal standpoint, I remind you. What we will discuss can impact anyone, influenced by factors such as lifestyle, injuries, comorbidities, and the individual healing potential. We look at the spine, and in the spine we have 6 layers of muscle in the back. So I'm just going to focus on the spine part. It can happen anywhere. It can be in an ankle, it can be in a knee, it can be in an elbow, it can be in a wrist. But for the sake of this musculoskeletal part of the fibrosis, we look at the spine. There's 6 layers of muscle in the back. And what I want you to see is how the spine actually becomes an anchor. It's an anchor to the muscles that attach the spine through the tendon. And then it does actions, our ability to lift our leg up, lift our arm up, or bend back or forward. The spine creates the anchor for everything to pull on to create these movements. And at these points, you see the tendon here, the muscular tendon junction at several points in the spine. This will make more sense to you as I explain fibrosis and what it does in this talk. Fibrosis, also known as fibrotic scarring, is a pathological response to wound healing, where connective tissue replaces normal parenchymal tissue. If left unchecked, this process can result in remodeling of the formation of permanent scarred tissue. So you'll see normal tissue over here is kind of like a smooth texture. It's soft, it's supple, it's flexible, it's highly functional, and decreased joint load. Whereas once it becomes fibrotic, you can see it almost becomes like a marble piece of meat. It becomes hardened. It doesn't move as much. It doesn't have the same texture and flexibility as it once did. Fibrosis is triggered by repetitive microinjuries, again, chronic inflammation, and ongoing repair, all of which can contribute to the development. While this process is essential for healing, it can lead to progression and irreversible fibrotic change, responsible if tissue injury is severe and repetitive, or the wound healing response becomes deregulated. It changes. And I'll explain how that cellular structure can change as we age and why some old injuries will come back to haunt us and why when we're young we actually heal better. So in this case, a biomechanical movement, actions of the spine. Let's look at fibrotic changes within the tendon and muscles and how it affects the spine, like I said. The cellular basis of fibrotic tendon healing. Because the tendon healing process results in formation of fibrotic scar, injured tendons never regain the mechanical strength of the uninjured tendon, leading to frequent re-injuries. This is important in the athlete, but it's just as likely or just as much important as anybody else for that matter. Many tendons are also prone to the development of peritendinous adhesions and excess scar formation, which further reduce tendon function and leads to chronic complications. Tendon injuries are common and can significantly impact a person's mobility and productivity. Fibrotic scarring within the tendon can hinder its ability to regain mechanical strength, increasing the risk of re-injury. Additionally, adhesions and scarring can contribute to chronic complications. Tendon injuries are almost the most common orthopedic injuries, with unsatisfactory healing leading to 9 million surgeries in 2013, accounting for 19.2% of musculoskeletal diagnosis in the U.S. In 2017, 500,000 full-time employees were affected by injuries to tendons, ligaments, and muscles. Surgical intervention for these injuries are all too common, and recovery takes at least 6 to 8 months. Anybody that knows anything about ligaments, it's a 6 to 8 month healing time. So these athletes that come off the field or somebody that injures himself and they have the expectation they're going to be back on their feet in a short period of time, that's not going to happen. That's not the amount of time it takes for these to heal. And the nutrition that's not there is going to cause the recovery to be slower, which I'm going to explain as we go. So tendons do not heal with their native structure after an injury. Instead, they form a disorganized extracellular matrix that we know as a scar. While this scar may offer some stability, it lacks the integrity of the original tissue. And we see again the smooth muscle, the strained tissue, decreased function, increased pain. Why do we have the decreased function, increased pain? Well, the pain is because the scar tissue that develops creates a space-occupying type of lesion. What happens is it expands. And if you don't have apoptosis, which is slow cell death or controlled cell death, to control the sequence of it, what happens is it grows and becomes space-occupying. It compresses the nerve, that creates pain. It can compress the artery, and now you have more healing crisis, or you have more injury that ensues. So then you get decreased function and risk of re-injury. So the process of it, the inflammatory phase, is here. What we have is we have margination of the blood vessels. They expand and they start to bring in more blood to the injured site. You elevate the neutrophils, monocytes, macrophages, which are white blood cells within the immune system. Then your T helper cells activate the immune system, and the mast cells come into play as well. From a musculoskeletal injury perspective, it is essential to apply damp ice. This goes back to the injury, whether it be an athlete or anybody else. When we twist an ankle, we have a car accident, we injure the neck in a whiplash, or we get hit in a football injury with a knee. We want a Rice method, which is rest, ice, compress, and elevate. But we also want to getting into some things like proteolytic enzymes immediately to stop the inflammatory process so we don't get that cascade of scar tissue development. We look at things like proteolytic enzymes. We look at things like bone morphogenic proteins. Yes, bone morphogenic proteins. The reason why that is because what the bone morphogenic protein does from supplementation that carries that is it actually aids in apoptosis, which allows that cell to control itself so the recovery is faster. It actually controls the amount of scar tissue you get, slows it down to the full healing recovery occurs. So it can promote apoptosis, which helps regulate the scar tissue formation. As we age, we experience a decline in apoptosis, explaining why, as we get older, that term old injuries come back to haunt us. We become stiffer, we become achy from problems of injuries that we've had in the past. So here's the enzyme we use. This is a proteolytic enzyme. I would do in an injury state, as long as you're not in any blood thinners or have clotting disorders in your blood, I'd use no less than 15 a day for 3 days, 3 times a day, empty stomach, to help stop that inflammation process quickly. We use the regen bomb to get those stem cells in there to bring in the new tissue, to lay down the new tissue and start the healing as fast as we can. Calcifood has the veal bone, which is going to have that bone morphogenic protein in it to help the apoptosis, to slow down the development of the scar tissue and get us back to our regular tissue or the healed tissue. So that you can find in either a powder or tablet form. So the proliferation stage, this is where it becomes active. This is where the damage ensues. You have the fibroblasts become activated and they start to deposit collagen, which I'll explain in more detail in a moment. You have tendon thickening forming of the scar. Then you have the S100A4 found in bridge scar tissue, which is actually where it draws in calcium and puts it into the tissue to create some stability so that you still can use or have functionality in that tendon or ligament or muscle, whatever it may be. It's usually ligament or tendon. So by adding this, it gives it you can accept a mechanical load. In other words, the athlete can get up, come off the field, the person can stand up and walk away. But it doesn't mean they should stay on it. Doesn't mean they should go and play more. Doesn't mean they should continue doing what they're doing. What we want to do in that case is we want to have that mechanical strength there to do the movement, but we want to keep the calcium from settling in there more and more and more with re-injury. So what do we use? We're using the magnesium. We ice it, we rest it, we elevate it, we compress it. We do the proteolytic enzymes for the inflammation, but we also want to use magnesium to keep it from over-calcifying. This will happen in chronic tendinosis cases. People will tend to get calcium in the tendon. So here's again what we use, the enzyme, which is a proteolytic enzyme to stop the inflammation. And this is the magnesium that I like to use for this, to be an antagonist to that calcium that's going to try to settle into that injured ligament or tendon. So here's how it looks. You have the blood vessel up here. You have the fibers of the tendon here. What happens, you have an insult, an injury. You have a whiplash, you have a sprained ankle, an inversion sprain. You have a kid that goes across the middle and gets hit in a football game, takes out his shoulder, his knee, and you actually tear these fibers here. These all become torn. What happens at that point is the blood vessel will marginate, which means open up, and it'll bring in all the neutrophils, macrophages, and monocytes. Now, the neutrophils come in first. They make what you call a neutrophil extracellular trap. What that is it's kind of like a stringy kind of stuff that goes in and fills in these gaps where the injury occurred in the soft tissue. Now what happens is the monocytes, macrophages come in and they activate the fibroblast to become a myofibroblast. And now what that does is it begins to lay down all the collagen in there. So the collagen will lay down in there. If it continues, it's apoptosis at that point doesn't control the amount of how much collagen gets laid down in the cascading effect of where it's going. What will occur at that point is this whole area becomes scar tissue. Now, if apoptosis stops as we age, like it will do, the scar will actually expand out farther, even taking over some of the other tissue. But we have this. Now, why is that important? Because when a ligament and tendon, it's kind of like a rubber band. They'll pull apart and they'll spring back. They'll pull apart and spring back. That's how they're supposed to work, stabilizing joints and that, and movement. So what happens when you start to develop and you get this scar tissue, now that ligament does this. It lacks that movement. So now you have those people where they develop the scar tissue in there. That's where you start to see the loss of movement, the loss of range of motion. That's where you start to see people becoming stiffer with their injuries that they developed. So this is huge. Now, scar tissue can't be adjusted by a chiropractor. It can't be massaged by a massage therapist. It can't be stretched out by a physical therapist. This has to be dissolved. That's the only way we're going to get to it. Sure, exercise might help slightly, but you have to dissolve that scar tissue before you can get the rehab going in the tissue underneath. So here's some patients that we've seen with fibrotic changes. Show you the changes, and I'll tell you, we used a formula that we came up with here at DHS to get their fibrotic change to dissolve to give them improvement. This is our patient Sandra, been a patient here for many years, going into fibrotic changes. She had it in her back, and today we both noticed her low back adjusted much easier, right?
Correct.
But then she told me something else. Tell them about your hip.
Well, when I sit on the bed and try and put my pants on, it's been stiff trying to move my hip, and it's not as stiff anymore. It moves a lot easier trying to get into the lace of my pants.
And it's only been 30 days that she's been on this stuff that she's noticing these mobility changes, flexibility changes, range of motion changes. Perfect. This is our patient Brendan. He's a monster hockey player, and we're talking about fibrotic changes and what happens with, when you injure or get micro injuries, repetitive micro injuries. He had one to the head. He had concussions. He had monster headaches that he was having on a regular basis. How often were you having those headaches?
Yeah, every day.
Every day headaches. And it took how long to get that fibrotic change and those headaches gone in the brain?
Good 1.5 to 2 years, I would say.
The patience it takes sometimes to get rid of this fibrotic change can be long. But in 1.5 years, you have absolutely no more headaches.
No signs at all.
So here's a case where it's not quite fibrosis yet, but I used the glucosamine for the joint. Now, tell them what happened, how that knee slowly changed on you.
I was having pain every time I would step down, like to go downstairs, upstairs even. And he gave me glucosamine 2 weeks ago, and within a week, it was gone. The pain in my knee was gone. I can move freely now, up and down the stairs, no problems, no issues at all.
Her term was it faded away.
Mm-hmm.
And her hip and her iliopsoas muscle was tight. We're taking care of that, but that pain just faded away in the knee.
Yeah.
Now that's not truly fibrosis in the knee. That's more of a early changes to ligament headed that way. And with the type O's, you hit them with that glucosamine, it'll knock that out. That's perfect. Because he's that short, stout, fibrotic guy. His spine was like bamboo, remember?
Mm-hmm.
Times I would adjust him, I don't even know if anything was moving, but it was stiff. We put him on this serrapeptase, nattokinase for several weeks. What happened today?
Pretty much every place he went to adjust me, I could actually hear
Audible release.
the adjustment working
Yeah. What that
for the
is,
first time in years.
this is nothing but a gas release from the joint. When you hear that popping with a chiropractic adjustment, it's not a popping, it's a gas release from the joint moving. And so we heard that up and down the spine. The serrapeptase nattokinase have broken down the fibrotic tissue, and now his vertebrae are starting to move again. This is going to protect him from some long-term problems. That's fantastic. So we lost one of our patients to Florida. It was a patient that Dr. Tet and I shared, and we used that formula that we came up with at DHS. And this would happen to this man. He was teaching another individual, a younger man, how to drive a semi. And he said, when you get to the mountains, just, wake me up, because I'm going to teach you how to do the braking system through the mountain. So what happened was he didn't wake him up. He got caught up in the mountains. He lost control of the truck. He jumped out of the cab, lost his life to that. And then Dean went right off the side of the mountain in the semi. I can only imagine what that looked like. But he was bouncing around in that truck like probably a rat in a bag. He developed all kinds of injuries that became fibrotic over the years. And like I said, as you get older, you lose that apoptosis for that cell to know when to stop expanding, growing. Controlled cell death, as they call it. And what happened was he's become stiffer and stiffer and stiffer over time. Well, when we put him on the formula that we're using for this to dissolve this fibrotic tissue, it was amazing to see the difference in his neck, his movement, his flexibility in the mid-back. It literally was dissolving the fibrotic changes enough that we were starting to get, as I said, the audible releases in the joint, and the joints were moving again. For the chiropractors out there, you've all experienced this. You've had those patients that come in, you adjust them, it feels like a dead end point. You never hear the gas release or audible release. You don't feel the joint movement or the joint play, as they call it. And what happens is you wonder, are we really moving the joint and giving them relief and giving them flexibility and the improvement with the subluxation that we should? I don't know that we are when we have a fibrotic patient. So for those patients that you've struggled with, adjusted time and time again and felt like it was a dead end feeling, I'm telling you, once you start dissolving this fibrotic change, it's amazing what we see. In less than 30 days, I had a man today tell me he could turn his neck 90 degrees when he was very rigid and very stiff a month prior to that. So that's the kind of results you'll see with the formula that we're using. This is Dorothy, a patient of ours, and she had a frozen shoulder with some serious fibrotic changes from that shoulder, not even from an injury. She woke up with it. So we put her on our little formula that we came up with for breaking down, dissolving fibrotic change. I'm going to let her tell you what she couldn't do and what happened today and what she now can do.
So I started out where I couldn't even get my arm past here. Definitely couldn't raise it up above my arm. Started taking the supplements about 5 weeks ago, along with physical therapy. But today, after the adjustment and taking the supplements, I can actually get my arm to here, which I could not do.
So it was fantastic because right after I adjusted it, we heard the clunk where it dropped in like a hip dropping in, and all of a sudden she throws her arm up like that. So our little formula broke down enough of that fibrotic tissue in there between the ligaments and tendons and such that it allowed that to release, that we could finally adjust it. Perfect. That's good now.
It's wonderful.
All right. That was another good case. Dorothy basically had a frozen shoulder from the fibrotic changes, and it was amazing after that adjustment, after being on that formula for several weeks, to watch that arm just move after one adjustment. It was fantastic. That's the kind of results you can get with the formula that we're using here at DHS. Now, it's important to understand how this ligamentous fibrosis affects not only the functionality and biomechanics of the spine, but also the nervous system. Because if you stop movement, if you have fibrosis in the tendons here, here, or here, and all of this eventually attaches to the spine to create movement, what happens when it becomes fibrotic and there's no movement? The spine is dynamically supposed to be always moving continuously. So here's a little video clip on that.
The spinal column, or backbone, is one of the most important parts of your body. It provides the main support, allowing you to stand upright, bend, and twist. 33 individual bones interlock with each other to form the spinal column. The vertebrae are numbered and divided into regions. C1 through C7 cervical vertebrae form your neck, support your head and neck, and allow you to nod and shake your head. T1 through T12 thoracic, that's the 12 vertebrae that are joined by ribs to form your rib cage. L1 through L5 lumbar, your 5 sturdy lumbar vertebrae carry most of the weight of your upper body and provide a stable center of gravity when you move. 5 vertebrae of the sacrum and 4 of the coccyx are fused. It makes up the back wall of your pelvis. Between each of the movable vertebrae is located the intervertebral disc. Intervertebral discs consist of a thick outer layer with a crisscrossing fibrous structure, annulus, that surrounds the soft, gel-like center, the nucleus. Discs function like shock-absorbing springs. The annulus pulls the vertebral bodies together against the elastic resistance of the gel-filled nucleus. When you bend, the nucleus acts like a ball bearing, allowing the vertebral bodies to roll over the incompressible gel. Each disc works in concert with 2 facet joints, forming a spinal motion segment. The biomechanical function of each pair of facet joints is to guide and limit the movement of the spinal motion segment. The surfaces of the joint are coated with cartilage that helps each joint move smoothly. Directly behind the discs, the ring-like vertebral bodies create a vertical tunnel called the spinal canal or neural canal. The spinal cord and spinal nerves pass through the spinal canal, which protects them from injury. The spinal cord is the major column of nerve tissue that is connected to the brain and serves as an information superhighway between the brain and the body. The nerves in your spinal cord branch off to form pairs of nerve roots that travel through the small openings between your vertebrae, intervertebral foramens.
Okay, each spinal segment actually moves in 6 ranges of motion. Now, we talked about the spine being an anchor for the muscles, but also it's a protective for the spinal cord and up in the skull, of course, the brain. And it's a superhighway of information that moves at about 250 meters per second squared, which means the brain it's like a wiring harness is on a car. It's constantly talking to all the componentries in the body to tell them what to do and how to do it. So every one of these vertebrae independently moves in 6 different ranges of motion of one another. So back to what we were saying about the fibrotic change, it's going to prevent that. So they got to move in flexion, extension, right rotation, left rotation, lateral bending. That all occurs around that disc, of course. These movements are made possible by the disc that it sits on. It's actually a fulcrum, as we know in physics, and it pivots on that disc. Now, that area back here, this is where the nerve comes out. So the nerve and the functionality of the nerve is strictly controlled by the opening of that IVF. Now, the intervertebral foramen is made up by the lower part of the upper vertebrae, the disc, the lower part of the lower vertebrae, the pedicle, the back of the spine is here, and the facet joint. That makes up this whole opening area, and it's pretty congested. There's about 7 things that run through there. So it's dense. So it has to move continuously. So it's formed by those those things there. It makes up that intervertebral canal. Now, the size and shape of the opening of the IVF are affected by movements within the spinal column or spine. The constant change in size and shape of the opening of the IVF with movement helps create pumping action with the nerve and spinal cord. This pumping mechanism aids the movement of cerebral spinal fluid, not outside the spine. It stops at the IVF, but in the spine, that spinal fluid's got to move. That lubricates and, believe it or not, protects the spinal column from compressive forces. Therefore, it is important for our spine to move freely in all ranges of motion to maintain the proper function of the central nervous system, along with all the organs and tissues being innervated by the nerves.
Cerebrospinal fluid is also abbreviated as CSF, and it's a colorless liquid which has a purpose to protect the brain and spinal cord from physical and chemical damage. It circulates through the ventricles of the brain, the subarachnoid space, and the central canal of the spinal cord. Cerebrospinal fluid is actually part of extracellular fluid, and it contains various substances which are both organic and inorganic. It contains glucose, lactic acid, proteins, urea, and positively charged ions like sodium, potassium, magnesium, and calcium. It also contains negatively charged ions like chloride and bicarbonate. An important thing to note is that cerebrospinal fluid also contains lymphocytes. The total volume of cerebrospinal fluid in a healthy adult is between 80 to 150 milliliters. There are 3 main functions of cerebrospinal fluid, and the first one is to provide a suitable chemical environment for neuronal signaling. The balance of positive and negatively charged ions helps with the production of action potentials and postsynaptic potentials. If this balance is disrupted, it can seriously disrupt the production of these nerve potentials. It also has a function as a shock-absorbing medium. It helps to protect the delicate tissues of the brain and the spinal cord from sudden, jerky movements which would cause these structures to bounce off the bony surfaces like the cranial cavity or the vertebral canal. And the third function is that it's also involved in the exchange of nutrients and waste between the blood and nerve tissue. There are 4 cerebrospinal fluid-filled cavities in the brain, and they are called ventricles, and they are located here. There is a lateral ventricle in each.
Okay, that gets a little complex there, but what I'm trying to get you to see is it helps the conduction of the nerve impulse by having that cerebrospinal fluid free to move up and down that spinal cord, as well as protection from any kind of forces or traumas. So it's very important. So the spine has to continue to move. So if you have these fibrotic changes that are preventing movement in the spine, what happens is it's going to alter how that cerebrospinal fluid works. Now, this chart shows which area of the spinal cord and cord regulates and controls different organs in the body. Each organ is connected to a specific nerve that comes from a region of the spine. So every region in the spine, the cervical, the thoracic, the lumbar, the sacrum, coccyx area, all these different regions in the spine control different organs within our body. So you can see the importance of how the spine moving, how the spine conducting takes care of the entire body. Very important. Over time, fibrosis in the tendons can limit movement in the spine and the joints and the arms and legs. This decreased spinal mobility affects the position and movement of the intervertebral frame and openings, which can directly impact the function of the central nervous system by reducing nerve conduction. As nerve conduction diminishes, it not only restricts everyday movement, but it also raises the risk of more serious health issues. To give you an example, actually what happens is in the upper dorsal or thoracic, the first 5 nerve roots control the heart. Typically, the heart will beat at about 72 beats per minute. But if you cut that neurological supply from that area to the heart automatically goes into 100 beats per minute. So it's very important that the signal response to and from the organs, to and from the cells and tissues is continuous all the time so that it can regulate everything in the body. So peripheral neuropathy happens when the nerves that are located outside the brain and spinal cord, what we call the peripheral nerves from the spine out, are damaged. This condition often causes weakness, numbness, and pain, usually in the hands and feet. It can also affect other areas of the body's function, including digestion and urination. The peripheral nervous system sends information from the brain and spinal cord, also called the central nervous system, to the rest of the body through motor nerves. The peripheral nerves also send sensory information to the central nervous system through sensory nerves. Peripheral neuropathy can result from traumatic injuries, infections, metabolic problems, inherent causes, and exposure to toxins. One of the most common causes of neuropathy is diabetes. Every nerve in the peripheral nervous system has specific jobs. Symptoms depend on type of nerves affected. Nerves are divided into sensory nerves, motor nerves, and autonomic. So, the movement and compression changes at the IVF result in a direct loss of nerve conduction or action potential to the corresponding cell, tissue, organ that nerve controls. Examples of this are noted by the first 4 thoracic vertebrae, which I've talked about, with the heart rhythm and rate. Normally 72 beats per minute and go to 100 if those nerves were affected. Another area of concern is the functionality of the autonomic nervous system, which is made up of the parasympathetic and sympathetic components. The sympathetic nervous system controls the fight or flight response within our body. Therefore, fibrotic changes within the ligaments of the thoracic area of the spine could significantly alter that effect on that nervous system, the sympathetic nervous system, by changing how the IVF works. Pupils will dilate, the heart rate will increase, relaxation of the airway muscles, sweat production, and slow digestion can occur when the sympathetic nervous system is overreacting. The opposite of the sympathetic nervous system is parasympathetic, located in the neck and the sacral area. And what happens there, that's the neck and the low back area. The peripheral nervous system controls your body's response during rest. Therefore, its job is to relax and reduce the body's activity. It constricts the pupils, increases saliva, relaxes airway muscles, reducing the work your lungs do during rest, lowers heart rate, and increases your rate of digestion, as well as helping food digest. Proper bowel and urine tract function relies on the parasympathetic nervous system. Therefore, gross fibrotic changes within the tendons, ligaments along the spinal column could affect the function of either one of these 2 nervous systems, depending on which area of the spinal column develops fibrotic change. Just like scoliosis causes the spine to curve, which eventually has a damaging effect to the lungs, these fibrotic changes affect movement, will impact nervous system function. So it not only tells you why it's important not to have fibrotic changes, but it also tells you why the chiropractic adjustment is hugely important for regulating and balancing the nervous system. Let's not forget, chiropractic was never for back pain originally. The first patient, Harvey Lillard, was a patient that had a hearing deficit, and Dee Palmer adjusted the fifth dorsal nerve and corrected his hearing problem. That's a central nervous system problem. That's not back pain. So it's important to adjust the spine, not only for back pain, if you have back pain, but to regulate the nervous system. And fibrotic changes can prevent movement of the spine, which will hamper how the nervous system functions. What type of injuries can cause fibrotic changes? Well, any repetitive injuries or those that cause ongoing inflammation, and the tissue level can eventually lead to fibrotic changes in various tissues throughout the body. Age also plays a role. As we get older, the process of apoptosis decreases, resulting in increased fibrosis due to the abnormal tissue remodeling. It can't control how fast the scar tissue is growing. It usually will self-regulate with apoptosis. Events, sporting events, that's very common sense there to know that any kind of sporting events, from basketball where you might sprain an ankle or fall on your back, a cheerleader might jump off somebody's back and land on their tailbone, a hockey player might internally rotate his knee and destroy his knee. Exercising. You would never think exercise. You think, wait, exercise is good for us. Well, here's how exercise works. If you exercise continuously on a routine, then it's good for you. But if you start exercising, stop, start exercising, stop, start exercising and stop, it actually is bad for you. It'll make free radicals. It'll actually damage tissue. It's better off to be more regular in a routine with your exercise over time than it is to be that weekend warrior that every January buys the gym membership and goes for 2 weeks and then stops. That's more damaging to the body. Everyday activities, shoveling snow, cutting wood, carrying groceries in, all these things can injure ligaments, tendons, muscle tissue, and create fibrosis. So, fibrosis in various tissues, other tissues of the body, not just the musculoskeletal. What else can happen? Well, fibrosis can develop in any tissue in the body that experiences repetitive damage, chronic inflammation, or alteration in healing mechanisms. This damage can be triggered by various factors, including infection, prolonged exposure to irritants such as silica and radiation, and autoimmune conditions. Essentially, fibrosis can affect any solid organ or tissue and is a common feature in many diseases. It arises as a repair mechanism following tissue damage, replacing functional tissue with non-functional connective tissue. Over time, this scar tissue can compromise organ function. Organ specific. So pulmonary fibrosis. Fibrosis and thickening of the lung parenchyma disrupt normal tissue architecture, oxygen CO2 exchange, and can lead to respiratory failure. Again, chronic inflammation of the lung tissue due to other autoimmune conditions is usually the causative factor, although all causes may not be known. Some things should be noted is that the literature referenced the importance of a holistic approach to this specific condition. Now, in practice before, I've had 2 cystic fibrosis patients, and one of them I had success with early on because of this and this. I didn't have this at the time. And what had happened was he was doing quite well. He was pretty stable. I don't know how long he would have gone, because what happened is during his therapy, he came up on the lung transplant list. What had happened was they transplanted his lung, and then a month later he lost his life to rejection. So we never got to see what the outcome or the long-term outcome of that was, but we had great success with these 2. I brought this one in because Breath of Life is fantastic. It's an herbal liquid that actually repairs and lubricates the lung. It's great at getting infection out of the lung. It's great at getting viruses out of the lung, and it's very healing to the lung. We have great success with this with bronchitis, with asthma, with pneumonias, with upper respiratory infections, with that wet cough that they can't seem to get rid of. This is a home run with this. But we had success with that. I don't know what the long-term outcome would have been because we lost the patient. Hepatic fibrosis. And here it is. Healthy liver goes fibrotic. Fibrosis turns into cirrhosis, and then we can go into carcinoma. So excessive extracellular matrix accumulates in the liver, is driven by factors such as viral conditions, hepatitis, autoimmune hepatitis, alcohol, non-alcohol fatty liver, which, by the way, is becoming so prevalent in the country today with young children. Too many sugars, too many carbs are being consumed by everybody, and this can lead to what we call non-alcoholic fatty liver, which can literally go into fibrotic change in the liver. So these kids have to watch. I mean, years ago, we never had these kids drinking Starbucks coffee at 10 years old, but that's basically what? Chocolate milk coffee, I call it. It's all sugar. Now, any of these can cause liver injury leading to a chronic immune response. This response triggers a collagen secretion within the tissue, which replaces normal liver cells with scar tissue. It should be noted that liver fibrosis is a reversible process, unlike pulmonary fibrosis. However, if the accumulation of connective tissue becomes too excessive, then liver failure can occur. One of the things that we know, or I've read about in the literature, is milk thistle is one of the only things they know that can reverse cirrhosis, or at least they say that in the literature. Can the vaccine against COVID cause liver disease? Well, don't shoot the messenger. I'm just giving you the message. Isolated causes of liver inflammation have been reported after the administration of the COVID-19 vaccine. In these cases, the type of liver inflammation that is observed is similar to autoimmune hepatitis. The author found that among the 470,274 individuals who received the COVID vaccine, 0.038% developed liver disease. No difference were found between the frequency of liver damage induced by RNA or adenovirus vaccine, 0.038 versus 0.024. In the control group vaccinated with influenza, the frequency of liver damage was higher. So the forest for the trees in this one is the influenza vaccine may be no better. In this case, it isn't. So I would be careful with those vaccines and what they can do. The dirty side of soap, triclosan. I've talked about this in other seminars. The hand sanitizers, the antibacterial soaps. Research at the University of California, San Diego School of Medicine reported potential serious consequences of long-term exposure to this chemical. Published on November 17th by the Proceedings of the National Academy of Science, the study shows that triclosan causes liver fibrosis and cancer in laboratory mice through molecular mechanisms that are also relevant in humans. Studies have found traces in 97% of breast milk samples from lactating women and in the urine of nearly 75% of the people tested. So these are your triclosan, can be in your hand sanitizers and some of your antibacterial soaps. Take it to the natural. Protecting the liver. Reduce your alcohol intake. That's a huge protection. Reducing medication as much as possible. Let's not forget our liver is the giant detoxifying organ in the body. Proper diet to avoid excessive carbohydrates and sugars to prevent that non-alcoholic fatty liver. Lifestyle changes and health measures to reduce and prevent viral load, and cessation of substance abuse. Now, if I'm looking to clean up the liver, this got the milk thistle in it. I like the Livaplex. Why would I use berberine? Because I said, remember what also causes non-alcoholic fatty liver? Excessive carbs and sugars. So run your sugars up, create that adult onset diabetes. This works fantastic. Now the literature is coming out saying how well berberine works for getting plaque out of the coronary arteries and other arteries of the body. So berberine's a home run for blocking this carbohydrate sugar ingestion. Glucose sugar balance is another great one that we use around here with great results. I've even had people on insulin pumps reduce the amount of inulin that the pump puts in once they're doing this, one with each meal. And then beta TCP is basically your betaine and vitamin C. The betaines come from beets, and that's very therapeutic. If you have those high liver enzymes from that fatty liver and can't get them down, this is a home run at about 8 to 10 a day, it really drops those liver enzymes. I've dropped them in a month to normal ranges. And we've had some as high as 194 and dropped her down to 32 within 2 months. So cardiac fibrosis, myocardial fibrosis, and this is a one that's close to me a little bit with my mother, and I'll explain why in a minute. A common feature of many cardiovascular pathologies is the loss of normal heart function. Mechanicalness, oh, that's a long one. We'll let you read it. The process of fibrosis is the same as in other disorders in that excessive secretion of collagen leads to fibrotic formation. Typically, this fibrotic tissue lacks the conductive and contractile function of healthy heart muscles. Although this change in tissue does not conduct or contract like normal cells. It will provide reinforcement to prevent catastrophic failure, such as rupture following a heart attack, but it won't allow normal heart function. In other words, you don't get that nice contraction at the scar tissue where it develops after the heart attack. Prolonged blood pressure elevation, volume changes, and sugar metabolic dysfunction associated with aging can cause fibrotic tissue deposits along with the loss of heart cells. This will lead to the heart wall thickening and stiffness, which will reduce heart chamber capacity, impair output, and eventually result in heart failure. The electrical conduction changes brought on by this can lead to arrhythmias such as atrial fibrillation, heart block, and tachycardia, or increased heart rates. So in other words, to understand that, just know that after a heart attack, wherever that heart attack occurred, you're going to get a fibrotic scar there. That scar is never usually going to beat again. But this is what we did for my mother. My mother's in her 90s. She's going to be 94 on October 4th coming up here. And at the time we did this is about 20 years ago, she had a heart attack. That's when she started listening more, started taking the nutrients. But on an echocardiogram, this is what they found. My mom eating a bag of chips, doing her paperwork for her business at night. If you remember, my mom years later had a heart attack. And usually when you have a heart attack, you have a scar in that area on the heart that won't beat anymore. I want to show everybody the power of nutrition and what it can do for you. I'm going to introduce Cindy here. She's going to tell you a little bit about herself. Then she's going to tell you what she saw on my mom's heart. Cindy?
Hi, I'm Cindy Valentine. I'm with Know Your Health Now. And we did do a screen on Dr. Gill's mother. And I did see the scar from the heart attack. And it was an interesting exam because generally, like Dr. Gill said, after a heart attack, that muscle tissue quits pumping. And on Dr. Gill's mother, with the aid of nutrition and good care, that muscle tissue was squeezing and doing its job. We could still see the scar from where the heart attack occurred, but the heart attack, it was no longer, it didn't affect that heart area anymore. So she still had very good cardiac function despite having had a very significant heart attack.
This is the kind of results we can get with good pharmaceutical grade nutritions that work well. So what I recommend in that case, what I would done for my mom over years is run that cardiac profile that we have here at DHS and basically put them on nutrition to balance out whatever comes up on that cardiac profile. That's basically what I did. Getting rid of all the inflammatory factors, the C-reactive proteins, the homocysteine, the lipoprotein A's and B's, and we got that scar on her heart muscle actually contracting again. And her stents that she's had for 20-something years have always stayed clear by keeping out those inflammatory factors. Usually stents get replaced in 8 to 10 years. So personally, when dealing with fibrosis of the heart, it is important to understand the underlying cause. For example, some cases of heart fibrosis may be caused by viral attacks, which others may be caused by circulation disorders. I feel that no matter what the treatment approach you use, I believe running a cardiac profile along with the treatment should be done to bring all results into normal function. This is how I brought my mom's heart back. Heart scarring detected more than a year later on the COVID-19 vaccine. Again, don't shoot the messenger. Australian researchers revealed that 1/3 of patients who suffer from myocarditis after getting a COVID-19 vaccine still had heart scarring more than a year later. In this study, the median time between the day the person received the vaccine and when they underwent follow-up image was 548 days. The longest interval among the studies was 603 days. The researchers wrote, "We find that the incidence of persistent myocardial fibrosis is high, seen in almost a third of the patients at 12 months post-diagnosis, which could have implications for the management and prognosis of this prominently young cohort." They cautions that we do not yet know what the long-term clinical implications of this are. According to the British Heart Foundation, heart scarring caused by myocarditis means the heart needs to work harder to pump the blood and oxygen through the body, which can cause the heart muscle to grow bigger and weaker over time. It's enough scar forms there, it can cause congestive heart failure and dilate cardiomyopathy, the Texas Heart Institute notes. And you can read the other studies here. So, don't shoot the messenger, read what you see. So here's what we use in the heart. Cardio Plus is a home run, and Tenzyme's a home run. You have the bromelain in there. You have the chymotrypsin in there, which is one of the number one things to break down plaque in arteries as well. You have the pancreolipase in there. It's all anti-inflammatory to the heart. I like the B6, B12 folic acid because it really pushes down that homocysteine, which is another inflammatory chemical. Love the hawthorn for the strength of the heart muscle and re-establishing that contractility of the heart muscle, and the serrapeptase to break down some of that fibrotic scarring. Renal function. Renal fibrosis occurs same way. Extracellular matrix, proteins accumulate in the kidney, disrupting normal organ architecture, decreasing blood supply, and ultimately leading to organ failure. Chronic scarring can lead to hypertension, diabetic neuropathy, and other conditions. Renal fibrosis has similar mechanisms between organs brought on by environmental factors, repetitive injury, chronic inflammation. Again, it should be noted that all fibrosis is the result of the breakdown of normal wound repair, resulting in overproduction of collagen within the tissue. Treatment of fibrosis should be geared towards removing environmental factors, reducing repetitive injuries, and resolving chronic inflammation. So in the kidney, when the kidney's not functioning, the Gaminol and the cytozyme KD are a home run to get and keep the kidney functioning, to keep the fibrotic change from occurring, and again, the Intenzyme to break down the inflammatory process that starts the cascade of the cells producing the fibrosis. Gastrointestinal. Fibrotic tissue can accumulate anywhere along the digestive tract, including the esophagus, stomach, small intestine, or large intestine, and represents inflammatory bowel disease like Crohn's and ulcerative colitis. Early detection is important, since once fibrotic tissues develop, removal of inflammation at this point is unsuccessful. Primary bowel fibrosis caused by inflammatory reactions results in difficulty swallowing, bowel obstruction, and abdominal pain. Damage to the bowel can also cause malabsorption, leading to weight loss, nutritional deficiencies, and anemia. So, here's some home runs for your gastrointestinal people. Anybody with the colitis, the diverticulitis, I use lots of this. Everybody that knows me here knows I use a lot of this. There's a couple different powders I use. This is the one I like to use. It's a little bit more inexpensive, and it works like a home run for all those colitis, diverticulitis people, or that inflammatory bowel condition. Dysmucine granules basically is your SOD, superoxide dismutase, that typically is produced at the appendix, and this is very anti-inflammatory to the colon. I'd also use it if you've ever had a neoplasm in the colon as well. And then you got the serrapeptase that aids along with breaking down the fibrotic changes that may have occurred before you got to it. Potential therapies for fibrotic prevention. Fibrotic change, whether within muscle, ligaments, tendons, or organs, are brought on by the immune system response to multifactorial causes. Factors such as wear and tear from everyday life, high force, and high repetitive movements can overwhelm tissues like ligaments, muscles, and tendons, leading to a healing response in those tissues by an autoimmune response. We often hear people talking about old injuries that have come back to haunt them, which is a common feeling for someone dealing with fibrosis, at least from a musculoskeletal standpoint. You don't feel your liver, right? This is because fibrosis will get worse with age due to the changes within the cellular healing process. You lose that apoptosis. Fibrosis does happen at different levels for everyone due to many causative factors, some being what we would consider everyday life events. Any trauma can trigger changes in the tissue response and healing. Typical repetitive actions that lead to the inflammation can result in injuries to ligaments, tendons, and muscles. Chronic overuse is a common contributing factor, but lifestyle choices can also play a role. For example, inconsistent workouts or performing household chores too aggressively in a repetitive manner can create problems as well. The weekend warrior guy that's going to cut down the tree in his backyard but never held a chainsaw in his life. That's what the weekend warrior stuff that can create fibrosis. Potential therapies for fibrotic prevention. Environmental factors such as parasites, virus, chemical exposure, inflammatory reactions, allergic responses, radiation, and tissue injury contribute to these issues. The chronic inflammation resulting from these conditions changes cellular behavior within the tissue, leading to an overabundance of that fibrosis. In younger individuals, tissues can often return to a normal state, but with repetitive stress, this ability diminishes with age. As a result, age and repeated injuries can lead to overhealing of the tissue, resulting in that long-term fibrosis. Nutrition therapies cannot be ignored when it comes to dissolving and preventing and stabilizing tissue response to fibrosis. Remember what I said: chiropractic, PT, massage therapy, even medical drugs. They're not going to dissolve the tissue if it's not in the right way. So looking at this, the studies, Dr. Ben Wilkes, PhD and biochemical engineer, is now a research fellow at Harvard Med School and Massachusetts General Hospital. He discovered that altering the composition of nutrients in which cells grow would help stabilize the formation of the tissue matrix for days to weeks or even months. Remember, it's the tissue matrix that changes in the fibrotic process. So nutrients, the right nutrients, prevent this. By stabilizing the formation of the tissue, Dr. Wilkes noticed the fibroblasts were aligning and synthesizing what resembled what is seen in normal connective tissue, is making the tissue normal. Dr. Wilkes stated, "I've never seen this before in an engineered tissue construct. This strengthens the tissue against injury that could lead to immune reactions resulting in fibrotic change." Exactly what we did with my mother. At 90-something years old, we got that heart still beating. There's also the issue of genetic variation and conditions related to fibrotic change, such as cancer, cystic fibrosis, and Marfan syndrome. There's a genetic factor there. However, environmental factors typically determine which genes get activated. Therefore, nutrition still applies to genetic therapies for prevention. This is also noted in the book Deep Nutrition: Why Your Genes Need Traditional Nutrition by Catherine Shanahan, MD. It is explained that gene expression can be altered by bending the gene through proper nutrition, which can impact the outcomes of genetically related diseases. No longer if Uncle Ben, your brother John, your dad, your sister had heart attacks, do you have to suffer that. They're finding out now that you can alter genes by bending the genes through nutrition. The book Deep Nutrition talks in depth about that. To put it in perspective, over the years as a chiropractor, I've noticed that all patients with circulatory disorders and past myocardial infarctions, strokes, coronary artery disease, etc., all had stiff and rigid mid-backs. It felt like there was no movement, joint play in the upper back areas. On x-ray, there was no arthritis and or known fibrotic changes in the ligaments or tendons of the muscles of the spine. What was noticed was that after only a few months on nutrition to correct and or prevent circulation issues or things that were involved with their condition, is that spine started to move. It became flexible, giving rise to movements with the audible popping sound of what is known as the cavitation of the joint, movement. I realized that we were changing something much deeper than just musculoskeletal faults within the spine. As time went on, I began to realize we were changing something within their condition. So several people like Dean Myers, my mom, other people with the fibrotic changes, the guy today in the office, we notice as we dissolve the fibrotic changes with our protocols, we're seeing the spine starts to move. We're also starting to see that this fibrotic change is just not the ligaments and tendons. This could be the heart, could be the liver, could be the kidney. and it'll associate with that area of the spine, wherever it may be. And remember what I said, the first 5 segments is the heart. So if you got stiffness and no movement up there, and you're adjusting it over and over and over, or massaging, whatever it might be, whoever you are, whatever professional, you better start to look at the organ that it correlates with. Time and time again, with the right nutrition geared towards balancing the cardiac profile, I noticed the changes in the spinal flexibility, especially the upper back area. Now, that's the end of my fibrotic talk. I'm going to play this for you because it gives you an idea. Dr. Tent one time said in a lecture, we're devolving. We're not evolving in health. We're devolving. We're actually getting shorter and weaker and less healthy. And I think seeing this, not to make a political statement at all, just showing what the level of health is happening in our United States. We claim to be one of the best medical or health countries in the world as far as diagnostics. But look at what's happening in the United States. It's time to get back to health. It's time to seek out the right doctors to balance the factors in your body to keep you healthy and free from any kind of health conditions.
Today, 2/3, we spend more on healthcare than any country on earth, twice what they pay in Europe. And yet we have the worst health outcomes of any nation in the world. We're about 79th in health outcomes behind Costa Rica and Nicaragua and Mongolia and other countries. Nobody has a chronic disease burden like we have. And during the COVID epidemic, we had the highest body count of any country in the world. We had 16% of the COVID deaths, and we only have 4.2% of the world's population. And CDC says that's because we are the sickest people on earth. We have the highest chronic disease rate on earth. And the average American who died from COVID had 3.8 chronic diseases. So these were people who had immune system collapse, who had mitochondrial dysfunction. And no other country has anything like this. 2/3 of American adults and children suffer from chronic health issues. 50 years ago, that number was less than 1%. So we've gone from 1% to 66%. In America, 74% of Americans are now overweight or obese, and 50% of our children. 120 years ago, when somebody was obese, they were sent to the circus. There were case reports done about them. Obesity was almost unknown. In Japan, the childhood obesity rate is 3% compared to 50% here. Half of Americans have pre-diabetes or type 2 diabetes. When my uncle was president, I was a boy, juvenile diabetes was effectively non-existent. A typical pediatrician would see one case of diabetes during his entire career, a 40 or 50-year career. Today, 1 out of every 3 kids who walks through his office door is diabetic or pre-diabetic. And the mitochondrial disorder that caused diabetes also causing Alzheimer's, which is now classified as diabetes. And it's costing this country more than our military budget every year. There's been an explosion of neurological illnesses that I never saw as a kid: ADD, ADHD, speech delay, language delay, Tourette's syndrome, narcolepsy, ASD, Asperger's, autism. In the year 2000, the autism rate was 1 in 1,500. Now autism rates in kids are 1 in 36, according to CDC nationally. Nobody's talking about this. 1 in every 22 kids in California has autism. And this is a crisis that 77% of our kids are too disabled to serve in the United States military. What is happening to our country? And why isn't this in the headlines every single day?
So, Diverse Health Services, that's who we are. Support local, take care of your local businesses. We need it more than ever. The economy. Food research is who we use. Biotic research, Standard Process. These are some of the different supplement companies we use. They're organically based. We've been to their farms. We've watched how they do it. It's painful to watch true organic farming because it's very, very tedious. So the products we use are bar none the best. Right from the ground up, the companies own everything from the tractor, the guy that drives the tractor, all the way up to the bottling. We make sure our products are the best for you so we get the best results. Thank you for listening.